Now from Times Square, TJ Holmes and Amy ROBACH with what you need to know.
Hey, good afternoon, everybody. Thank you so much for being here with us on this Tuesday at GMA3. Glad everybody. I'm still almost wanting to call it Good Morning America 3. That's not right, right?
It's GMA3.
I should say.
You can call it whatever you want.
See how quick she got on to me?
No, I'm teasing. You can call it whatever you want. Right. And we, as always, have our ABC Chief Medical Correspondent, Dr. Jen Ashton, here with us as well. And we do have a lot to get to today. So many headlines to go through, but also some major developments that we've been tracking. The latest COVID numbers from Johns Hopkins University, the human toll from coronavirus marking a deadly milestone. More than 1 million people now around the world have died, with at least 33.3 million global cases. And the number of Americans killed since this pandemic began, right now at least 205,000.
And Doc, so much has been talked about with kids, so much debate it seems with children. So we do have there is no centralized database to track what's going on in schools, but you do have some new info here about trends in pediatric cases since April. What is it?
That's right, and just came out by the American Academy of Pediatrics at midnight, really the latest on the numbers. So take a look at this, you guys. They tracked over a 5-month period pediatric cases. These are confirmed cases, just over 500,000. They also are tallying 10% of all cumulative confirmed cases in the U.S. in the 0 to 18-year-old age group. And in just the last week, you guys, children accounted for anywhere from 12 to just under 16% of weekly reported cases. Now, remember, these are just confirmed cases, but the idea here is that we're starting to paint a picture of just what this virus looks like in this pediatric population. And that is actually a really frightening headline to look at, rapid rise in pediatric COVID-19 cases. But you say there are some caveats behind this headline. And important ones, Amy. So the story behind this headline right now is that you heard me just say they tracked this over a 5-month period, and the headline is these cases are going up compared to what? Remember, we just started to identify this pandemic in February, so they're not matched in terms of time. They're not yet doing widespread surveillance testing in this age group. So when we say confirmed cases, again, tip of the iceberg, and there is new emerging data that teens tend to be looking like they're getting infected more often than younger children. So this is an evolving picture in the pediatric age group, and we say it all the time. Kids are not little adults, and this study proved that.
All right, Doc, thank you so much. It changes every day. We keep learning. Evolving is the word you keep using. Thank you so much. We'll see you plenty throughout the hour.
So we're very proud of their performance, but it wears on folks over time.
Look, they have a tough job, our men and women. Anyway, so now the pandemic happens, put an extra strain, and you all are really at the forefront, really, of trying to find a solution to this global problem with Operation Warp Speed, trying to find a vaccine. And I know the initial idea was to have a vaccine ready to go by January 2021, and eventually have 300 million doses. Is that timeline still reasonable? Is it still likely?
So from end to end on the COVID pandemic, whether it's building hospitals, augmenting staff to hospitals, delivering food, and even running nursing homes, the Army is central to the Operation Warp Speed effort. Medical Research and Development Command of the U.S. Army helped co-develop the vaccines for Ebola and Zika, and now are central to this effort for the pursuit of a COVID-19 vaccine. There's about 5 to 7 candidates globally that we are working with the private sector, utilizing our labs to compress development time, as well as looking at the testing and distribution sites around the country. There will be vaccine candidates that will become available in the December-January timeframe, and then those doses will continually be pushed throughout the United States, and we'll work with our allies and partners as well.
All right, well, sir, we always appreciate you all taking the time. These are very tough topics and tough times, but I think we all can still applaud the men and women of our military for the work they're doing under the added pressures now of this pandemic. Thank you so much for the update. We hope to see you again.
Thanks, TJ.
And coming up right here on GMA3, Dr. Jen Ashton answering a number of your questions about the coronavirus.
Let's start with hair loss, though. Question 1 from a viewer: has there been any documentation of hair loss as a side effect of COVID-19 infection.
A lot, you guys, and I'm hearing more and more about this every single day from viewers, from my patients. This is the typical time period we would expect to see kind of a shock alopecia or hair loss, which we can see after a stressful physical or in some cases emotional trauma acutely, happens 3 to 5 months later. The good news is most of the time that hair growth will restore itself, but it can take months for that to happen because such is the life cycle of a hair follicle. A lot of people noticing this.
All right, well, earlier we were talking about pediatrics and COVID-19. This is a very specific question. Have we seen any adverse COVID-19 related effects on newborns?
So neonates you're talking about right after delivery, you know, in the first couple of weeks after birth, very, very limited data. What is available right now suggests luckily, there have been no major case reports of acutely ill neonates, even those who have moms who were COVID positive in the delivery room. So again, we know that newborns are very vulnerable to all types of infections. So medically, socially, everyone erring on the side of caution when there's a COVID positive mom, taking all the precautions, masks, gowns, gloves, hand washing, but trying to keep that mom and newborn with their baby as much as possible. Very tough situation.
All right, next up here, does the sun have any effects on COVID-19?
All right, TJ. Now, follow me on this one.
All right.
Any virus, and in fact, most pathogens can be deactivated. They can be desiccated when exposed to sunlight. The question is how much sunlight for how long a period of time. And we also have to say, unfortunately, we do have to make this crystal clear, not once COVID is in the body. You can go out and get all the sunlight you want, and it's not going to do anything to SARS-CoV-2 once it's in your body and causing an infection. So you have to balance that. Get some sunlight, get some vitamin D, but not because you think there's going to be an instantaneous demolition of the SARS-CoV-2 virus.
Oh, let
There you
doctor
go.
speak. Instantaneous demolition of the virus.
Right.
You can submit your question to Dr. Jim on our Instagram at Dr. J. Ashton. Thanks as always.
You bet.